and welcome all to Module 1. So for those that weren't able to be at Module 0, a special welcome to you. And please don't worry about missing Module 0, as you can access the recording of that from the website. And if you've got any sort of questions, then please email us about sort of navigating around the website and things like that. So today we're going to be looking at arguably the most important part of the whole process, which is developing the review question and protocols. And we're going to start with a presentation by Lucy on review questions and PICOs, and then that's going to be followed by a couple of group exercises where Mark Rogers and Melissa will also be facilitating. So without further ado, it's over to you, Lucy.
Cheers, thank you. Let me just share my screen. This one. Can you see that? Fabulous. Right, I'm just going to minimize you so I can see all my notes. Brilliant, lovely. So yes, as Mark said, my name is Lucy Shepherd, and I'm a research fellow based in CRD. And I'll be talking through, as Mark said, developing your review question. And as Mark also said, this is really important to think about, and it kind of lays the foundations for the rest of your systematic review. So it's a really important thing to get right. So yeah, we've got a presentation, and then we've got some group exercises a bit later on. But in Module 0, for those who are there, we asked you what sorts of reviews you're potentially interested in. And it was really nice to see that there was a range of review topic areas that people were interested in evaluating, and all of these are really valid and appropriate topic areas for a systematic review to be conducted in. But also what was interesting was there was a range of different types of review and type of evidence that people wanted to use. So there was a lot of people that were interested in looking at the effectiveness of interventions. There was people that were interested in sort of the prognostic or predictive factors in developing a particular condition, for example. We had some people interested in qualitative research as well. And there were also people who were looking to do a scoping review. And while that is a distinct research method compared to a systematic review, hopefully a lot of what we talk about can translate into that scoping review methodology. And it may be that you do a scoping review to sort of nail down exactly what you want to focus a systematic review on in the future. So it was really nice to see a range of lots of different things. One thing I want to say is that we'll be focusing on the PICOS criteria today, which is mainly for systematic reviews looking at the interventions and the effectiveness of interventions. But don't worry if you're not doing that, because so many of the different components of the PICOS criteria can be translated across to lots of different reviews. And we've got some examples of some other sort of structures for questions in a couple of slides' time. And what we saw in Module 1 was actually a lot of people had a really broad idea or aim that they wished to investigate by conducting a systematic review. But often it wasn't actually specific enough to guide a lot of those important decisions that you'll need to make when you're conducting your systematic review. So we'll be looking at turning that broad idea or aim into a systematic review question. So this is an example from a study that we did in CRD a few years back now, and it was, will prescribing progesterone to women at risk of preterm birth improve the outcomes for the mother and baby? So it seems like a reasonable question. We know what drug they're looking at. They're looking at progesterone, and we know that they're interested in high-risk women. And we know that they're interested in outcomes for both the mother and baby. So it seems like a reasonable question. But if we think about it further, how is that risk defined, and what does that include? There's lots of different types of progesterone, and it's not really clear what sort of progesterone they're interested in and whether they're comparing it against other treatments. And also, what are these outcomes, and how and when will they be measured? It's not really that clear. So what actually seemed to be a reasonably comprehensive question was actually quite woolly and not really specific enough to guide the important decisions that you need to make during your systematic review. So let's have a look at the components of a review question. And as I said, we'll be focusing in this presentation on the PCOS criteria, which is population, intervention, comparator, outcome, and study designs. But there's lots of other different types of review question structures, and these are just some examples here of some alternatives that might be more relevant to your systematic review. And we'll be putting a list of these up on the website that you can have a look at, so you can have a look. But as I said, most of the stuff that I'll be talking about can be translated to your review in some way, or at least you'll get an idea of the sorts of things you need to think about when you're looking at each of your components. So we're going to go through each of the PCOS criteria one by one, and we're going to start with the population. And this is probably going to apply to almost all of your systematic reviews that you're going to be conducting. So first of all, what is the population? So if you're focusing on a particular sort of condition or disease, how is that defined or diagnosed? So if you're looking at depression, for example, do patients need to score a particular score on the Beck's Depression Inventory? Or does it need to be diagnosed by a particular test for cancer, for example? Are you going to be focusing on a particular patient demographics, such as patients of a particular age, gender, or ethnicity? And you may also want to be focusing in a particular setting, such as a particular country, or patients who are being treated in a certain healthcare setting, such as the hospital or the community. I think one thing that is really important to think about, and again, this translates across the PCOS criteria, is thinking about having some decision rules in place about how you're going to deal with studies where only some of the criteria are met. So you might get a situation, for example, where only some of the population of the study that you're looking at are relevant. And what are you going to do in that situation? In my work, I do a lot of research into childhood cancer, and we get a lot of studies where they include both children and adults with cancer. And so what we say when we're doing our screening is if there are, we will include studies where over 50% of the population included in the study are under the age of 18. So the majority are relevant to our systematic review, or if they provided separate outcomes for the children and young people. And that's a really clear way that you can sort of make decisions and sort of have that transparency throughout your systematic review as to why you included or excluded particular studies. I think when you're thinking about these decision rules, you kind of need to know the area and know the best approach to take, because what you want to balance is the reduced applicability by including studies where there are participants who don't meet the eligibility criteria against the loss of data where studies are excluded. So in our case, in the childhood cancer world, mainly what we're looking at is studies where there are sort of young people up to the age of 25, for example, included in these studies. And that means that it is a more applicable paper than, say, if it was a situation where a lot of the studies were including those where there were 80 or 60-year-olds included. So that's the sort of thing you need to think about and have a knowledge of that before you go in. Okay, back to our preterm birth example. So what did we say? We said women at risk of preterm birth. And we split this into 3 different categories of at risk. First one was a previous experience of preterm birth. Second was a multiple gestation pregnancy. So they were pregnant with twins, triplets, or more maybe. And third was a short cervical length. And again, that's a pretty woolly definition. And we said we would include any definition, and we made that clear. But what we also did was we did some additional analyses where we looked at different cutoffs of a short cervical length. So that could be 25mm cervix, or it could be a 30mm cervix, for example. And we again made that clear in our protocol about those decisions that we made and the subgroup analyses that we would conduct. It's also important to think about whether there are any particular populations that you don't want to include in your review. So one thing that we said was we didn't want to include studies where women were having progesterone to prevent a miscarriage. We set that out at the start, and again, it just makes it really transparent and clear about what you're doing and what studies you're going to be including and excluding. Right, on to the intervention of interest. This could be intervention, it could be a particular exposure. So if you're looking at an epidemiological review, for example, that could be something like in utero exposure to alcohol. You could be looking at a particular policy, such as junk food advertising bans on public transport. Or it could be a diagnostic test, such as a breast cancer screening program, for example. Again, you need to really think about the specifics here. Is it important how the intervention is delivered, who delivers it, and when it's delivered? If you're looking at a drug, for example, you need to think about the dose, duration, and frequency of administration, and whether that sort of thing is important to capture. It might be that you're actually interested in a range of interventions, and sometimes that can be really helpful for decision makers to have a range of options on the table and when you're looking at your systematic review. But when you do this, think about some common or core features of that intervention that you're looking at. So, for example, if you're looking at interventions for smoking cessation, you may say, we will include all interventions on smoking cessation if they include some form of educational element. And again, that just really helps to make screening easier and make those decisions really transparent as you move through your systematic review. So in our preterm birth example, we said we were interested in progesterone. For those that don't know, which probably many of you don't, there's lots of different types of progesterone that can be given. And we were interested in all forms and all methods of administration. And again, what we said was it had to be given beyond the 16th week of pregnancy again. So we wanted to exclude those women who were receiving progesterone for a miscarriage. Okay, on to the comparator next. So there's lots of different types of comparators that you could look at when you're looking at the effectiveness of interventions. And it really depends on what you're interested in. What sort of effectiveness are you interested in? Are you looking at the absolute effectiveness of an intervention? And if that's the case, you need to think about including a placebo or waitlist control. So that could be looking at cognitive behavioral therapy for anxiety compared to people who are still on a wait list, or before and after sugar tax implementation. There's some examples there where you could look at the absolute effectiveness of an intervention. But you could also look at the relative effectiveness, and when you do that, you need to use a well-established comparator or standard of care. So that could be looking at a novel cancer therapy, for example, compared to a well-established chemotherapy that is currently being used on the NHS. It's also possible to compare the same intervention that's delivered in a different way. So you could have an educational intervention in school that's delivered by a teacher, and you could compare it to that that's delivered by a psychologist, for example. So in our preterm birth example, we were interested in both the absolute and the relative effectiveness of progesterone. So we looked at placebo and non-intervention, so standard care for the absolute effectiveness. And we also want to look at the relative effectiveness of the different types of progesterone. And again, something that we said was that we were excluding progesterone when it was given or it was compared to other active interventions. So that could be something like bed rest used to be one, or a cervical stitch, for example. Those were sorts of things that were given to prevent preterm birth, and we weren't interested in those. And again, we were clear with that when we were setting out our PCOS criteria. Okay, moving on to outcomes. Now, an outcome could be absolutely anything. It really could. And it really depends on what your systematic review is looking at. But here are some examples quite specific to the health research world. But it could be something like a health state, so an incidence of a cardiac event. You could look at quality of life, behavioural change, such as the number of cigarettes someone smokes a day, or it could be a healthcare resource use. So how many hospital admissions did a person have or a population have before and after an intervention? What's really important again is thinking about how and when an outcome will be measured and whether that's important. And if you're including an outcome such as quality of life, where there are lots of different measures of quality of life, what are you going to do in that situation? Are you only going to focus on one? Or if you're looking at multiple, how are you going to synthesize that evidence together? And one thing that we are very big advocates at CRD is really thinking about what is important to stakeholders, thinking about what's important to your patients and families, and the experts in the area, is you really want to make sure that your research is meaningful to those it's going to impact. So discuss those with stakeholders. I think that's a really, really important thing to say. I think another thing to mention as well is that you might have a wide range of outcomes that you're looking at. And sometimes having a large range is quite good, because not only can you show where there is evidence, but you can highlight where there isn't any evidence. And that can be equally important when you're thinking about your results and your conclusions from your research. And actually specifying that beforehand could be a really, really helpful way to show that. So in our preterm birth example, our outcome was preterm birth. Again, that's not really specific. What does that mean? Is it a continuous measure of preterm birth, or is it categorical? Well, we had 3 categories that we were interested in. And these are sort of well-known categories where how preterm birth is split up. So that's a birth before 28, 34, or 37 weeks. And that's what we were looking at there. But we also had some other outcomes as well. And again, this kind of comes to our point about sort of trying to highlight where there is and where there isn't evidence. So we had a whole range of different things, such as sepsis, retinopathy of prematurity for the neonatal complications, and maternal complications as well. So maternal infection and preeclampsia. And we collected all that data where it was reported. Okay, finally, last but not least, is study design. I think it's really important to think carefully through this. Some study designs are going to be more appropriate than others for your systematic review, and you really need to think carefully about what is most appropriate for your review. So if you are looking at the effectiveness of healthcare interventions, randomized controlled trials are the most robust. But often this data might not be available. And so therefore you might need to consider other study designs. So that could be non-randomized trials. You could look at cohort studies, before and after studies, things like that could be more relevant to you. And again, that just takes a bit of knowing what literature is out there, and knowing what evidence there could potentially be to make that decision about what study designs you want to include. The choice of study design that you will choose will have a big impact on aspects of your systematic review, such as the risk of bias assessment tools that you include. So again, think carefully about that, because it will have knock-on impacts on the rest of your review. And if you are going to include different trial designs, so you may do that. You may say, ideally, we're looking at randomized controlled trials, and that's where our priority will be in terms of synthesis. But we may collect stuff on non-randomized trials too. That's absolutely fine. But again, think about how you will synthesize those results together. And again, if you're going to include multiple trial designs, think carefully about your risk of bias assessments and which tool you're going to use there. But that's going to be covered much later on in the course. So it was pretty straight and smoky for our preterm birth example. We were only focused on parallel randomized controlled trials. We knew that there was a lot out there on those, so it was quite easy for us to say these are the only things we're going to include, because they provide the best level of evidence that we can get. So we excluded the other types of randomized trials, or RCTs, observational studies, and the quasi-randomized studies. So they're studies where they claim to be randomized, but there's no real clear method or an appropriate method to conduct that randomization. Okay, so that is a whistle-stop tour of the PCOS criteria. And I think, as you hopefully have been able to see, we've moved from a really interesting but actually somewhat ill-defined question to a really clear set of boundaries that we can use for the rest of our systematic review. and especially when it comes to the selection of studies for inclusion. I don't know whether anyone's conducted a systematic review, but you go into screening with what you think is a really clear idea of the studies that you'll be including and excluding. But it becomes apparent quite quickly that actually having a really clear set of criteria can really help you, and you just have it open on another screen or in another window, just to have there to refer when you're doing that screening. It does make life so much easier, and it reduces the conflicts that you get when you're doing double screening and things like that. So think carefully through it. I'm just going to finish with some top tips, I suppose, or things to consider when you're thinking about your review question. As I said, you need to think carefully about this because it's going to inform a lot of your aspects in your systematic review process. It will inform your search strategy, what data you'll need to collect from each study, how you're going to structure your synthesis, the risk of bias assessment tools that you're going to select. So it needs to be thought out first, and you need to really take your time thinking about it. And that might mean that you spend some time reading previous literature that's out there, potentially some of the studies that you may include. And also it takes that collaboration with stakeholders as well to really get a really nice and well-defined research question. One thing it is when you're writing up your protocol, which I think Claire's going to go through in a bit in a second, is it's important to outline all of the aspects of your PCOS when you're describing your research question. So even if you don't necessarily have any clear restrictions, it just makes it really transparent for the readers. So for example, in a childhood cancer systematic review we've done recently, we would include studies if they had a comparator or not. So we made that really clear that sort of having a comparator was not not having a comparator didn't restrict inclusion into our study. So again, just keeping that transparency throughout is really important. One thing that we talked about in my group on Thursday in Module 0 was how broad or narrow do you go with your systematic review? And I think this is something that is really, really important to think about. So the first thing is resource. The broader you go, the more resource you're going to need as you're going to identify more studies. So that means you'll need more time from people, but you're also going to need more money to be able to do it. So really think carefully about that. We did a very broad systematic review on all of the interventions that had ever been done in a particular type of childhood cancer for when it had relapsed. And we had to screen just shy of 18,000 studies. And then the systematic review has included 120 studies. So that has taken a huge amount of resource to do everything with, really. That was really helpful because for decision makers, a broader review can mean it's much more applicable. You're giving options and you're saying what is best out of a range of different options. So you can say, we've looked at treatment A, B, and C, and we can see that treatment C is better than treatment A, but actually treatment B is better than all of them. So it kind of gives you that broader and more applicable conclusions from it, because you kind of are looking at all of the different options available. If you do go very broad though, you may include lots of different types of studies, and again think quite carefully about how you're going to group those together. If you're wanting to go more narrow, that's absolutely fine, but you may only find sparse evidence. Think about whether that matters. Sometimes it's quite good to be able to say there's not actually any evidence in this area, but if you are wanting to try to find some studies, you might need to think about potentially broadening it out a bit. And that really means that you kind of have to have a bit of an idea about the evidence base before you start. Okay, that is it from me. That's just some sort of things to consider. We can have any questions at the end, I think. We're going to go into a group exercise now. So what we want you to do in your groups is you go to Module 1 on the website and you'll see an example called spinal fusion. And this is about 2 types of treatment for degenerative disc disease. What we want you to do is propose some potential PCOS criteria based on some of the information available. So we've given you a bit of a summary about the condition and the potential interventions that are available. I think it's really worth noting we do not expect any of you to be experts in degenerative disc disease or spinal fusion procedures. We just want you to have a think about have a guess about the sorts of challenges and uncertainties that may arise with each of the PCOS criteria, and have a note down of what you think might be included in each of the different components. We'll want one of you to scribe, so there's a Google Doc for each of the groups. So if one of you could open that and share your screen, and then you can type in that, and then we'll want one of you to report back and in the discussion in a bit. So we'll have a bit of discussion after this. I don't think there's, well, I don't know whether you've got anything else to add, Mark, on that, or whether we can just get going.
No, I think that's okay. I think we can pop into the rooms if anyone's got questions. We can help. Oh, well, you've really thought it through, yeah. And I think I did hear some of those conversations, and I think one part of it was asking a question about, is this an inclusion criterion that we use to decide whether we include or exclude studies, or is this something that we need to think about once we've got the studies in front of us? You know, kind of like we include a bunch of studies and then decide how we handle these differences within the review. So yeah, basically this was quite fairly straightforward for this. For this criterion, we included people undergoing spinal fusion surgery for degenerative disc disease. And we also included spondylolisthesis, which is basically slip disc, because sometimes this is used for this. And we thought maybe that information might be useful, it might transfer across. But we did have those other considerations, which we'll maybe come on to a bit later on. Was there any other considerations you had about that technology, how it might, any variations or anything like that about how it might be applied? I mean, simply, yeah, RHBMP2 was the intervention that we included. So that's simply, yeah, that was kind of what we did. There's a few different ways it might be used. So it could be the way the operation is done could be done laparoscopically, or it can have an open operation. So things like this, so actually the way that it's put into the body can vary. But again, we just we weren't concerned about that in terms of selection of studies. We said we'll include any form of operative approach. And BMP2 can also be used in other bones, so it can be used for broken limbs, things like that, to fuse bones. So we just sort of said, well, we're only interested in the spine. So, you know, some people might say, well, actually, we're interested in this technology in general in terms of bone knitting, but we said specifically we're only interested in spinal studies. Most of these spinal fusions are used ICBG, so we wanted to see if this is better. So for that question of effectiveness, we said ICBG is our comparator. But in terms of safety, we said, actually, if we're just looking at adverse events, we'll look at any approach used for spinal fusion. So if there were other approaches, including any new approaches that might have emerged since we started this work, we would include those to look at the safety side of it. So yeah, that's great. Great. Yes, and it's a good point. Yeah, you probably will need to dig down into the outcomes side of it, because there's potentially lots and lots of outcomes that we measured. So for this, yeah, we were primarily interested in outcomes that matter to patients, which is on the efficacy side, which is pain. Basically, it's DDD is a very painful condition. People want to be free of pain and maybe any neurological effects. So we looked at disease-specific pain, quality of life, and then we looked at whether spinal fusion worked as a kind of, as a proxy for that. You're right to kind of look into kind of go, well, what are the adverse events? What are they? The reason why this work was commissioned was because there was concerns that there might be something called bone overgrowth, where basically the spine stimulates too much, the osteoclast is stimulated too much, there's too much bone growth, and it can impinge on nerves and things like that and create neurological problems. Or there was also an issue about maybe systemic effects in terms of cancers and things like that. So these were the things that we were interested in. But really, again, looking along the two threads of the review, the effectiveness, we had a set of criteria for selecting the outcomes for effectiveness, and then for adverse events we were completely open. We said any reporting of adverse events we'll look at. Great. Yeah, so again, I think you've picked up on this, that there's different studies designs can contribute different pieces of useful information. So again, we saw along the two strands of the review. So we were interested in only RCTs, the efficacy side. So if it was comparing BHP2 versus ICBG, we wanted only RCTs for that. We wanted to have the lowest bias, most accurate estimate for those. But then we were also interested more broadly in picking up signals on adverse events that perhaps might be missed by RCTs, which have very strict inclusion criteria, perhaps smaller numbers. So for those, we looked at, we included RCTs, but also non-randomized studies. But we did include comparative studies. We didn't look at just case series, because we already know that there's some concerns that maybe those rates are higher than you might expect in the general public, but now we want to move on to the question of actually, are these higher than alternative therapies? So there's two strands to that as well. So, but I think you've picked up on that. I thought it was interesting. I think group one were talking about things about sort of geographic spread and timing and stuff, about how this technology, where and when it developed and things, which is an interesting question. I think we kind of let that stuff kind of just shake out of what we did, with the PCOS. So kind of those things would emerge, and there could be important issues to explore in terms of heterogeneity. And, particularly when you're talking about surgery, there's often an issue with sort of expertise, like it's sort of, there's a learning curve for surgeons to do a lot of these techniques. So obviously, you can find that if the study has been done by the world leading centre who developed the technique, and they've done hundreds and hundreds of this procedure, they might have a different set of outcomes than perhaps people who've just picked it up for the first time. But those are things that we thought we would explore within the review, rather than in terms of selecting studies. Okay, great. So we'll put the full PCOS criteria that we used in the real review on the website, so you can have a look at those in a bit more detail at your leisure. And now we're going to have a brief second exercise, which is similar to the last one, but this time we require one or two people in each of your groups to be brave and put forward your own research question for discussion within the PCOS framework. So this could be really useful for you if you've currently got just a vague research idea and you haven't started your review. You want to scope it out a bit, you can kind of get some help with that. You may end up with a much better structured question. But even if you already started your review and you've made some progress already, you'll see that discussing your PCOS criteria with other people have benefits later on in the review process, all the way through to actually writing up